Welcome to CNA Practice Lab. Feeling bored reading the healthcare system chapter? Let's make it simple and fun. Test your knowledge with these quick CNA healthcare system MCQs and boost your exam confidence in minutes. Question 1. Which of the following facilities provides care for people who need 24-hour skilled care for ongoing conditions? A. Adult day services. B. Outpatient clinic. C. Long-term care facility. D. Hospice center. Correct answer is C. Long-term care facilities provide continuous, skilled nursing care for residents with chronic conditions. These residents require around-the-clock monitoring and assistance. Hospice focuses on comfort care, while outpatient and adult day services do not provide 24-hour care. Question 2. What is the name of the federal health insurance program for people who are 65 years of age or older? A. Social Security. B. Medicare. C. HMO. D. Medicaid. Correct answer is B. Medicare is the federal insurance program for individuals aged 65 and older and certain disabled individuals. Medicaid is income-based. Social Security provides retirement income, and an HMO is a type of insurance plan. Question 3. The chain of command in a healthcare facility is important because it A. Is only used during emergency drills. B. Describes the line of authority and helps ensure residents receive proper care. C. Determines which CNA gets the best schedule. D. Allows CNAs to give orders to the nurses. Correct answer is B. The chain of command establishes who reports to whom in the facility. It ensures clear communication and proper delegation of responsibilities. This structure promotes resident safety and accountability. Question 4. Which member of the care team diagnoses disease and prescribes treatment? A. Registered nurse. B. Physical therapist. C. Physician, doctor. D. Nurse practitioner. Correct answer is C. The physician is responsible for diagnosing medical conditions and prescribing treatment plans. Other team members carry out care according to those medical orders. The doctor oversees the overall medical management. Question 5. As a CNA, who is your immediate supervisor? A. Licensed nurse, RN or LPN/LVN. B. Administrator. C. Doctor. D. Director of nursing. Correct answer is A. CNAs work directly under the supervision of a licensed nurse. The nurse assigns tasks and monitors resident care. Administrators and doctors are not the CNA's immediate supervisors. Question 6. Which of the following is not a typical task for a nursing assistant? A. Helping a resident brush their teeth. B. Giving medication to a resident. C. Making a resident's bed. D. Taking a resident's blood pressure. Correct answer is B. Administering medication is outside the CNA's scope of practice unless specially certified. CNAs assist with personal care and vital signs, but do not independently give medications. Question 7. What is policy in a healthcare facility? A. The law passed by the state government. B. A course of action that should be taken every time a certain situation occurs. C. A verbal instruction given by a doctor. D. A step-by-step guide for completing a task. Correct answer is B. A policy is a guiding rule that directs decisions within the facility. It outlines what should happen in specific situations. Procedures, however, describe the exact steps for performing tasks.
Question 8. The inspection process done by the state to ensure a facility is following regulations is called A. Investigation. B. Checkup. C. Survey. D. Audit. Correct answer is C. A survey is a formal state inspection to evaluate compliance with healthcare regulations. Surveyors assess quality of care and safety standards to ensure facilities meet required guidelines.
Question 9. Which care team member helps residents learn to use adaptive devices like walkers or prosthetics? A. Registered dietitian. B. Physical therapist. C. Occupational therapist. D. Speech-language pathologist. Correct answer is B. Physical therapist. Physical therapists specialize in improving mobility and strength. They train residents to use assistive devices safely. Their focus is on movement and functional independence. Question 10. In a person-centered care model, who is the most important person on the team? A. Nursing assistant. B. Administrator. C. Doctor. D. Resident. Correct answer is D. Person-centered care focuses on the resident's preferences, choices, and individual needs. The healthcare team supports and respects the resident's decisions to maintain dignity and autonomy. Question 11. What is the primary goal of hospice care? A. To provide comfort and pain management for the terminally ill. B. To cure the patient's disease. C. To perform surgery on elderly patients. D. To provide physical therapy for a broken hip. Correct answer is A. Hospice care focuses on comfort, dignity, and quality of life for terminally ill residents. It emphasizes pain control and emotional support rather than curing disease. Question 12. If a CNA is asked by a nurse to do a task they have not been trained for, the CNA should A. Ignore the nurse and go on break. B. Do it anyway to be helpful. C. Politely refuse and explain they haven't been trained for it. D. Ask another CNA to do it for them. Correct answer is C. CNAs must stay within their scope of practice. Performing untrained tasks may endanger residents. Politely communicating protects both resident safety and the CNA's certification. Question 13. A facility that provides care for people who are medically stable but need help with ADLs is called A. Acute care hospital, B. Assisted living, C. Intensive care unit, or D. Subacute care unit. The correct answer is B. Assisted living facilities help residents with daily activities, such as bathing and dressing. Residents are generally stable and do not require 24-hour skilled nursing care. Question 14. What does the interdisciplinary team refer to? A. State inspectors. B. Family members. C. Night shift nurses. D. Healthcare professionals from different backgrounds working together. Correct answer is D. An interdisciplinary team includes doctors, nurses, CNAs, therapists, and others. They collaborate to create and implement a comprehensive care plan for the resident. Question 15. Which of these is a legal requirement for becoming a CNA? A. Working 5 years as a volunteer. B. Passing a state-approved competency evaluation. C. Having a college degree. D. Knowing how to perform minor surgery. Correct answer is B. Candidates must pass both written and skills examinations approved by the state. This ensures minimum competency standards are met before certification. Question 16. Which team member works with residents to improve swallowing and speech problems? A. Speech-language pathologist. B. Social worker. C. Respiratory therapist. D. Activities director. Correct answer is A. Speech-language pathologists specialize in communication and swallowing disorders. They assist residents recovering from strokes or neurological conditions to improve speech and safe swallowing. Question 17. What is the primary purpose of Medicaid? A. To fund medical research. B. To provide pensions. C. To provide insurance for low-income individuals. D. To insure all children regardless of income. Correct answer is C. Medicaid is a government program that provides healthcare coverage for individuals with limited income. Eligibility is based primarily on financial need. Question 18. When a resident is admitted to a facility, the CNA's most important role is to A. Perform a physical diagnosis. B. Make the resident feel welcome and comfortable. C. Get legal signatures. D. Take car keys. Correct answer is B. Admission can be stressful for residents. Providing reassurance and emotional support helps build trust and promotes a smooth transition into the facility. Question 19. If you witness a coworker yelling at a resident, what should you do? A. Report it immediately to your supervisor. B. Confront the coworker publicly. C. Tell other CNAs. D. Ignore it. Correct answer is A. Abuse must be reported immediately through the chain of command. Reporting protects the resident and ensures proper investigation and intervention. Question 20. A procedure is best defined as A. A general rule. B. A list of resident rights. C. A method or step-by-step way of doing something. D. The facility layout. Correct answer is C. A procedure outlines the specific steps required to complete a task safely and correctly. It ensures consistency in care delivery. Question 21. Which of these is an example of acute care? A. Rehabilitation center. B. Assisted living apartment. C. Nursing home. D. Emergency room treatment for a heart attack. Correct answer is D. Acute care refers to immediate short-term treatment for serious illnesses or injuries. Emergency room treatment provides urgent medical intervention. Question 22. Who is responsible for the overall management of the entire nursing home facility? A. CNA supervisor. B. Administrator. C. Head nurse. D. Dietary manager. Correct answer is B. The administrator oversees operations, staffing, budgeting, and regulatory compliance. They are responsible for the facility's overall management. Question 23. The term scope of practice refers to A. allowed work hours, B, tasks legally allowed to perform, C, number of residents assigned, D, salary. Correct answer is B. Scope of practice defines the legal boundaries of duties based on training and certification. Working outside this scope can lead to serious consequences. Question 24. What should a CNA do if they don't understand a medical term a nurse used? A. Look it up later. B. Pretend to understand. C. Ask the nurse to explain. D. Ask a family member. Correct answer is C. Clear communication ensures resident safety. If something is unclear, the CNA must ask immediately to prevent errors. Question 25. Why is it important for a CNA to be dependable? A. To get promoted faster. B. To work independently. C. To impress the administrator. D. Because residents rely on staff for their safety and daily needs. Correct answer is D. Residents depend on CNAs for essential daily care. Being dependable ensures residents receive timely assistance and prevents potential harm. Great job today! If you enjoyed this healthcare system quiz, get ready. More practice quizzes are coming your way. Don't miss the next video. It might have the exact questions you need for your exam.